Hi everyone, I'm Dr. Syed Athar Hussain, working as a consultant physician and diabetologist at Apollo Medical Center, Hyderabad. Hope you people had a healthy lunch. So today we are going to have a short and brief discussion on hypertension, that is high blood pressure. As you all know, nowadays, hypertension is something like Kahani Ghar Ghar Ki or something like Inti Ramayanam. So this is thanks to our lifestyle and of course dietary habits. So what is hypertension? Our today's discussion will be on what high blood pressure is and how to prevent it. So generally, everyone would like to have healthy or normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure on the walls of the blood vessels. This is called blood pressure. Normally, in a healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer time and left untreated, it can lead to serious health complications. In general, persistent increase in the blood pressure higher than normal blood pressure is known as hypertension. So high blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices, for example, not having regular exercise. And so nowadays we see so many obesity patients, and of course, smoking and alcohol consumption. And of course, we should not forget, last but not the least, of course, it's very important, stress nowadays, which is very, very common nowadays. So there are the risk factors that can also increases the risk of developing hypertension, such as age. As you all know, age plays a very important role. As the person becomes older, the arteries, it gets stiffened up and narrow as excess fat gets deposited in it. So second thing comes family history of high blood pressure. This is also quite common. One or more close family members with hypertension, there might be increases the person's risk of developing the condition. Excess salt intake is also known to raise blood pressure. Not eating enough food with especially potassium can increase the blood pressure and the risk of stroke and chronic kidney diseases. And of course, eating processed foods and fatty foods, all the junk foods nowadays what we're eating, it makes the heart work harder to push the blood through the body. Hence, it causes high blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further to high blood pressure. Another one is, of course, we should not forget stress and strain. Reacting to stress is in unhealthy ways or not managing stress can also increase the blood pressure. Moving on, hypertension does not have any obvious signs and symptoms. That is why sometimes it is also called as silent killer. It puts people at risk for several diseases from cardiovascular problem to kidney failure, stroke, and even eye damage and blindness. Hence, early and accurate diagnosis is very, very important management of hypertension. Measuring the blood pressure is the only way to know whether the person has high blood pressure or not. Generally, when symptoms do occur, they include morning headaches, tiredness, blurry visions, some sort of a ringing sound in the ears, easy fatiguability, lethargy, and of course sometimes nausea and vomitings. If person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument which is called as sphygmomanometer. So a blood pressure is recorded in two numbers, that is systolic and another is diastolic. Now let us try and understand what do these numbers actually mean. A healthy or normal blood pressure should be lower than 120/80, or it can also read as 120/80 milligrams of mercury. Here, the upper number indicates systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates diastolic blood pressure, where the pressure in the blood vessels when the heart rate beats. If the blood pressure level is more than 140/90, then the person have hypertension. If person have BP levels higher than this, then he or she might be at risk of developing some comorbid conditions, especially serious heart diseases. So we all know on May 17, we do celebrate World Hypertension Day, a day dedicated to highlighting the importance of monitoring blood pressure and bringing global awareness to 1 billion people living with high blood pressure worldwide. The theme of this year's World Hypertension Day is measure your blood pressure, control it, live longer, enjoy life. Ensure that your blood pressure is measured and controlled if it is elevated. So this risk can be prevented and reduced by taking steps towards a healthier lifestyles, such as regular exercise, which is lacking nowadays, healthy diet, of course, this is also very much far behind, quit smoking and alcohol intake, regular blood pressure monitoring, and stress management, and of course, adherence to any medicines. If the blood pressure is successfully controlled with such lifestyle modification, then it might avoid, delay, or reduce the need of medication. So let us take a look at these strategies one by one. So the very first thing is regular exercise or physical activity. Exercise can be a drug-free approach to lowering high blood pressure, which is one of the easiest way. Regular physical activity makes person's heart stronger. If one have a strong and healthy heart, it can pump more blood with the less effort. So if heart has to work less to pump, the force on the blood vessels will decrease and lower the blood pressure. In other case, as we all are aware that age and weight gains are the two major risk factors for high blood pressure. So if the blood pressure is at desirable level, that is less than 120/80, then exercise can help prevent it from rising as you age. So regular exercise also helps you in maintaining a healthy weight, which in my opinion is an important way to control blood pressure. One should aim for at least 30 minutes of aerobic activity at least 5 days in a week. High blood pressure level can be reduced by doing regular exercise, such as plain brisk walking, jogging, swimming, etc. Second thing comes healthy diet. Diet also plays a very, very important role in controlling blood pressure. A diet with a high intake of vegetables, fruits, and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adopt a dietary pattern such as DASH. So what is DASH? It stands for Dietary Approaches to Stop Hypertension Diet. So what we are supposed to do? DASH diet or a Mediterranean diet, eating less saturated fat and total fat, getting plenty of potassium, limiting the amount of sodium in the diet, and avoiding alcohol consumption. So, is eating a DASH diet that is rich in whole grains, fruits, vegetables, and low-fat dietary products, and skims on saturated fat and cholesterol can lower one blood pressure by up to 11 milligrams of mercury if the pressure is high. And then comes reducing the sodium intake in your diet. Even a small reduction in the sodium in the diet can also improve the heart health and reduce the blood pressure by about 5 to 10 milligrams of mercury. If you have high blood pressure, to decrease sodium in your diet, you can consider tips like read food labels if possible. Choose low sodium alternative of the food and beverages you normally buy. Eat fewer processed foods. Only a small amount of sodium occurs naturally in the foods. Most sodium is added during processing, so you can eat natural products. Please don't add salt. Just 1 teaspoon of salt has 2,300 milligrams of sodium. So avoid adding salt to food. Use herbs or spices to add flavor to your food. And the most important thing is quit smoking. Stop smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve your overall health, and of course, ultimately leading to reducing the comorbid conditions. So regular blood pressure monitoring is also very important. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for the patient to visit doctors and check up their blood pressure. Hence, most often I advise patients self-monitoring of their blood levels, how we are doing for the sugars. Self-monitoring helps person to measure blood pressure at different times throughout the day and over a longer period of time. It also assists doctors to get a more complete picture of person's blood pressure reading at different times. Further, it helps us in better prediction of cardiovascular morbidity and mortality rather than single routine blood pressure measures that occur during a clinical visit. And of course, we should not forget stress management. By learning how to relax and manage stress can improve emotional and physical health and lower high blood pressure. So stress in the sense nowadays we can say just try to avoid your hurry, worry, and curry. Okay, this plays a very, very important role in managing your blood pressure. Stress management techniques include exercising, listening to the music, focusing on something calm or peaceful, and meditation. Adherence to medicine. A medicine to lower blood pressure may be recommended by doctor if your blood pressure is consistently high, usually at or above 140/90. Adherence to medicine is very important as it controls your blood pressure regularly. At last, I'd like to suggest that there is nothing more precious than having a fit and healthy life. Adopting a healthy lifestyle can help us to enjoy the long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Thank you. Hope you have understood what I told you. Thanks.